just start with maybe one of the broadest questions, which is, what roles does social work play in the prevention of abuse? And Chris, I wonder if you'd be willing to get us started, since you're in a position to see many aspects of it in your role as chair of the Colorado Sex Offender Management Board.
Thank you, David. Appreciate it, and welcome everybody. We're glad you're all here. In terms of getting ready for this talk, I did my due diligence, knowing that David is a very researched and referenced person. So I looked up the definition of social work this morning, briefly, soon before this meeting. And I just thought it would be interesting to share one of them. I mean, there's many of them out there, but social work being a practice-based profession promoting social change, development, cohesion, and empowerment of people and communities. And it includes an understanding of human development, behavior, and social, economic, and cultural institutions and interactions. And I really like that definition just for the broadness of it. Obviously definitions by definition are subjective, but I think we could identify a number of different definitions of social work. But in my job in particular, I'm working at more of a macro level of social work. There's obviously the micro level. And when I'm talking about that, I'm talking about working with individuals versus working with systems. And so I think the nice thing about social work and being a social worker is that you can work at all levels. And I've had the opportunity and the privilege in my career to work at all levels. And so I think the nice thing about the work of social work in prevention of abuse is that we include those who are clinicians, we include those who are professors. We have a number of professors in this call here. We have those of us who are working in government and in systems, and we're trying to attack the prevention of abuse at all different levels: primary prevention, secondary, tertiary prevention. And so, in my job, I'm trying to deal with all of those levels at the same time. And I think that the nice thing about social work is it gives you that opportunity to really think about it in that very broad brush and broad lens. And so I hope that those of you out there who are social workers or are considering becoming social workers, that you would see this as a really valuable aspect of this work that and I think that's going to lead into another question. We don't necessarily have a very narrow scope. It's a very broad scope. And so those are some of my initial kind of kickoff thoughts. And I'm guessing some of the other panelists might want to add on to what I just said. Sure. Thank you, David.
Before anyone else jumps in, though, could I ask, we did get a clarifying question, which is, can you identify the source of that definition?
I will go and look for where I got it, and I will put it in the chat.
Great, thank you very much.
Yes, not a problem.
Yeah. Other thoughts, other perspectives? Yeah, Melissa.
Well, so I guess I would want to, for Chris referenced primary, secondary, tertiary prevention, and I thought it might be helpful just to explain a little bit about what those terms mean for people who don't know, and to think about. I've written a lot with both Jamie and Adam, and I feel like in every paper we talk about primary, secondary, and tertiary ways of what we need to be doing. So primary, this is from the Center for Disease Control, these definitions, and primary is universal. In other words, everybody gets it. So it's often used in public health. So anti-smoking campaigns are things that we do for every single person, no matter who they are, where they live, whatever their identity is, everybody gets it. Secondary would be for interventions that are targeting people at risk. So people that are at higher, they have some factors that create some risk factors for them that maybe other people don't have. Third level, tertiary, are people who have already experienced the event, whether it's a health condition or they've already committed a crime, for example, that they get a tertiary, the third level. And then our colleague actually in the UK, Kieran McCartan, he's been talking about, and I'm going to butcher the way this sounds. So David, if you know how to say it better than I do, let me know. Quaternary.
That's close enough, yeah.
So it's basically, we need to also consider the ramifications of the intervention. So an example that comes up a lot is when you give people medications for schizophrenia, they often develop diabetes. And so when we put people on the registry as a tertiary intervention, And then we create more problems for them later as a result of that intervention. So when I think about social work, I feel like there are, in every one of those levels, we are able to have an impact. We can create primary prevention, and we've got wonderful people at ATSA and other places who are working on that.